Well, malaria in Nigeria, we have battled it for decades. Children, women, old and young, there is no one that has, one way or the other, has tasted of malaria. Now, this target that Nigeria has to end malaria by 2030, I'm sure this has been on the front burner for a long time. But is it going to be achievable are we going to meet this target by ending malaria in 2030?
Yeah, thank you very much. Actually, like I said, my name is Mary Caleb. I work with Public Health Department of FCT. So by the special grace of God, we are working towards that and we will achieve that. So talking about malaria, what is malaria? You know, many people mistaking malaria with fever. What is this malaria? Malaria is a very dangerous disease that is caused by a parasite of the Plasmodium through the bite of an infected female Anopheles mosquito. You know, many people, many people mistaking fever with malaria. You have the same symptoms. What are these symptoms? You start having nausea, headache, body aching, and the rest. So the next thing people go to the pharmacies, chemists to say, okay, give me malaria drugs, which it might not be a malaria because you have to be bitten by that female Anopheles mosquito. And you know, many times mosquito can bite people. The next thing they'll say, mosquito have bitten me and I'm having malaria or something. So it's only through the test that you can detect that, okay, yes, this is a malaria. So that's why we encourage people to go to the facility to have a test before taking medication. We discourage all this self-medication and the rest. So when we comply with all these things, by the grace of God, I believe we will achieve it. And you know, this is not just the responsibility of the health workers or maybe federal government or the government. This is everybody's responsibility.
So from what you're saying now, you're saying self-diagnosis is what has stalled, you know, the ending of malaria.
Actually, it contributes. Yes, it contributes.
Are you talking in terms of mutation? Because a lot of people need to understand. You've helped us to understand what malaria is. Now, taking drugs and maybe not properly addressing that malaria parasite. I understand from, you know, research that it sort of mutates. Now, is this what has caused malaria, you know, to prevail till this time?
Actually, like I said, it contributes. Because taking self-medication without proper diagnosis can lead to resistance to the drugs. Because taking drugs not on the rules, because, okay, if you go to the pharmacist or maybe hospital, okay, these are the symptoms, this is what you're feeling. The doctor may ask you to go and have a test. After having a test, when the results come out positive, the doctor will prescribe a drugs for you. And they will tell you, okay, this is how you should take the drugs and make sure you complete it. And you know, people have this mentality of, okay, when you take it today, tomorrow, you feel better, they now stop. Okay. So, you know, finishing the drugs will help you to eliminate the parasite in your system. But leaving it alone, it's just maybe the symptoms are gone and the rest, then you stop. So before you know, you develop resistance to the drugs. And that's why you see many people start complaining that I've been taking the medication and it's not working. So it's because you're not sticking to that prescription that is guided by the doctor.
Okay, now how badly does malaria really affect our children and the pregnant women? Now, because describing you said seasonal malaria chemo prevention expert. Now, what is it all about in talking about the prevention and fighting malaria?
Okay, actually, talking about the pregnant women and the children, you know, we consider them to be vulnerable because their immune system are not that strong to fight the malaria. So that is why most of the times these children under 5 and the pregnant mothers goes down with malaria. It's because of their immunity that is not strong. So talking about SMC, SMC is one of the prevention method of malaria. But that deals with only children. Okay. That is from 3 months to 59 months on the 5. So what is this SMC? SMC is seasonal malaria chemo prevention. Like the word implies seasonal. It's targeted to during the rainy season of malaria because that is the peak that malaria transmission is very high. So, you know, is a combination of 2 anti-malaria drugs. That is SP and AQ. So we call it SPAC. SP and AQ. So SP means sulfadoxacin, parametamine, and then AQ means amiodarone. So it is a combination of these two anti-malaria drugs that are put together to prevent the children from malaria. And these drugs, it comes in tablets. We call it blisters. It comes in two forms. We have the one from 3 months to 11 months, and then we have the one of 12 months to 59 months. It's to prevent the children from malaria, not to treat the malaria. No. So, like I said, it's one of the preventive measures, methods that we are using. Of course, we have other preventive measures, like sleeping inside mosquito nets. We always encourage people to use all the methods so that at least the child will be fully protected during this period. And we have eligible children that takes these drugs, because even the children, it's not all the children that takes the drugs. Oh. So, like I said, SP and AQ, some children naturally react to these drugs. So we don't encourage to give them. And we always advise that we have a CDDs that are trained. And these drugs, it's not given like in the hospital or you go to pharmacies and buy it, no. They are given in house to house. We have a trained CDDs.
Like immunization? Like
immunization, yes. CDDs means community drug distributors. They are the people that we picked from the community. We train them on how they will administer these drugs. So they go from house to house. Like they asked in this house, is there any child that is of that age? That's 3 months to 59 months. If yes, they say, okay, we are here to give them the drugs. They have a reflecting jacket, green. You see them, they have identification that they can show you that, okay, they are from SMC, to give the children this malaria, preventive malaria drugs. So like I said, it's not to treat, it's to prevent it. So they give them.